Hello and welcome. In this video, we are going to talk about rehabilitation, what rehabilitation is, who makes up the rehabilitation team, how it relates to the nursing and medical team, and why interdisciplinary teamwork is important in rehabilitation. A study in 2019 found that there were 2.4 billion people worldwide who were living with a health condition that would benefit from rehabilitation at some point in the course of their illness or injury. That is at least 1 in 3 people in the world. The study also found that equated to 310 million years of life lived with disability. These numbers are expected to increase significantly as the global population grows, ages, and lives longer, and many with chronic conditions and non-communicable diseases. The same study found that the number of people who needed rehabilitation in 1990 was 1.48 billion, which means that there has been a 63% increase in this need since about 30 years ago. The researchers found that the 3 largest groups of health conditions that contributed to disability were musculoskeletal disorders, which was the biggest group, then sensory impairments, and then neurological disorders. The problem is that many people who require rehabilitation services are not receiving them. Of the people who need rehabilitation in some low and middle income countries, more than half of them are not receiving it. By 2050, low and middle income countries will be home to 80% of the global population aged 60 and up. Rehabilitation in many countries is often under-resourced and seen as a backup for when other interventions fail. So it is clear that the world needs more rehabilitation, but how do we meet those needs? The WHO, World Health Organization, has identified that, among other factors, one of the barriers we face is ineffective and underutilized referral pathways to rehabilitation. Ciesa and colleagues also suggest that rehabilitation services need better integration into the health system at the primary care level. One important aspect of this is the interdisciplinary rehabilitation team, which we will discuss a bit more later. Before we continue, we need to define rehabilitation. According to the WHO, rehabilitation is, quote, a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. The WHO goes on to say that rehabilitation helps a person, quote, to be as independent as possible in everyday activities and enables participation in education, work, recreation, and meaningful life roles such as taking care of family. Rehabilitation is accomplished through selecting evidence-based and person-centered interventions to address conditions and limitations, improve function, and provide support. It can play a big role in health promotion, maintenance, and prevention. The specific goals of rehabilitation will differ for each person depending on their goals and preferences. Rehabilitation professionals will typically go through a process that will include some or all of the following: assessment, diagnosis, planning, education, intervention, evaluation and reevaluation, and collaboration. The settings where rehabilitation occurs can vary greatly. It can take place in both inpatient and outpatient hospital settings, private clinics, institutions like schools or prisons, rehabilitation centers, community settings like individuals' homes, long-term care, workplaces, and more. Sometimes there are misconceptions about who needs rehabilitation services. Some think that it is only for people with disabilities and certain long-term impairments, or that it's a luxury service, or that it's only for when other interventions fail. The truth is, anyone can require rehabilitation at some point throughout the course of their lives, and it should be a core service in healthcare that is available to all who need it. So what are the benefits? On a personal or individual level, rehabilitation can reduce the impact of health conditions, minimize or delay the effects of chronic conditions, increase independence, enable participation in work, school, and other life activities, and improve quality of life. For example, let's take something as simple as using a hearing aid. According to Orji et al., if everyone who had hearing loss who required a hearing aid used one, then the associated disability would be decreased by 59%. On a broader system and societal level, rehabilitation can reduce hospitalization, length of stay, and prevent readmissions. This reduces costs overall. In addition, as Stuckey and colleagues point out, it allows individuals to continue to contribute to and participate in society as fully as possible and for as long as possible. Now let's talk about who makes up the rehabilitation team. We will briefly discuss 8 key members, but it is not limited to these professions, and it can vary depending on the context. According to the American Academy of Physical Medicine and Rehabilitation, physiatrists, or physical medicine and rehabilitation doctors, evaluate and treat patients with short or long-term physical and/or cognitive impairments and disabilities that result from musculoskeletal conditions, neurological conditions, or medical other conditions. Their goal is to decrease pain and enhance performance without surgery. Physiatrists usually lead a team of other professionals in order to provide optimal and holistic care. Treatment can include prescription of pharmacological treatments, ultrasound and fluoroscopy guided procedures, injections, prolotherapy, spasticity treatment, and more. Rehabilitation nursing promotes, maintains, and restores human life functions, independence, and social well-being through access to preventive, acute, and post-acute care continuum. Rehabilitation nurses will provide care to individuals right after the onset of any disabling injury or chronic illness and follow them through until they reach their goals. Rehabilitation nurses' role encompasses personal care, activities of daily living, short and long-term health, social and independence issues, emotional support, as well as educating the patient and family. There is currently a shift towards a more proactive approach in rehabilitation nursing, in that nurses are delivering care with the patient rather than just for the patient, and encouraging the individual to participate in their own care as much as they are able to. According to World Physiotherapy, a physiotherapist or physical therapist provides services that, quote, develop, maintain, and restore maximum movement and functional ability throughout the lifespan. The service is provided in circumstances where movement and function are threatened by aging, injury, pain, diseases, disorders, conditions, and/or environmental factors, and with the understanding that functional movement is central to what it means to be healthy. A physiotherapist has a deep understanding of the body's structure and function and can provide services related to not only orthopedic function, but also neurological, respiratory, cardiovascular, sexual, visual, and vestibular function. Physiotherapists take an active functional rehabilitation approach in therapy. Interventions can include therapeutic exercise, manual therapy, functional training, use of assistive devices, airway clearance, electrotherapeutic and mechanical modalities, modification of environment or home, and more. The World Federation of Occupational Therapists defines occupational therapy as, quote, a client-centered health profession concerned with promoting health and well-being through occupation. The primary goal of occupational therapy is to enable people to participate in the activities of everyday life. Occupational therapists achieve this outcome by working with people and communities to enhance their ability to engage in the occupations they want to, need to, or are expected to do, or by modifying the occupation or the environment to better support their occupational engagement. In this context, the term occupation refers to the activities people do every day, whether that is by themselves or with other people. Occupational therapists have been educated in the medical, social, behavioral, psychological, and psychosocial and occupational sciences and work with a wide range of conditions, though most often in relation to physical, mental, affective, and cognitive problems. Interventions can include therapeutic use of occupations, exercises, and activities, training in self-management, modification of environments, assistive technology and devices, driver rehabilitation, wheelchair management, adaptation of processes, and more. Speech and language therapists or pathologists assess and treat people with speech, language, communication, eating, drinking, and swallowing problems. Communication refers to processes associated with comprehension and production of language, whether it is oral, written, nonverbal, or an alternative form of communication. It also includes the social and cognitive aspects of communication. Speech and language therapists have extensive knowledge of the head, neck, and respiratory system. Interventions that speech and language therapists can employ include, but are not limited to, therapeutic exercises, biofeedback systems, and augmentative and alternative communication technologies, which refers to ways that one can communicate other than talking. Audiologists provide services related to the assessment, treatment, and prevention of hearing loss and auditory and vestibular impairments and disorders. This includes tinnitus, vertigo, ototoxicity, auditory processing disorders, and various types of hearing loss. Audiologists can prescribe and fit hearing aids and assistive listening and alerting devices. Other interventions include auditory training, ceremonal management, communication strategies, speech reading, technology interventions, and auditory and vestibular rehabilitation. Orthotists and prosthetists treat individuals through the fabrication and application of orthoses and prostheses to optimize function. According to the International Society for Prosthetics and Orthotics, an orthosis is a device externally applied to the body to modify structural and functional characteristics, such as braces and splints, and a prosthesis is a device externally applied to the body to completely or partially replace an absent or deficient limb segment, such as an artificial leg. Orthotic and prosthetic devices can also include mobility aids like walking frames. Clients can include children with congenital limb deficiency or cerebral palsy, individuals who have had an amputation, individuals with muscular weakness, and more. Clinical psychologists assess and treat individuals with a range of psychological difficulties relating to both mental and physical health. Conditions can include anxiety, depression, psychosis, eating disorders, addictions, etc. Treatment aims to reduce distress and symptoms, improve coping and functioning to allow individuals to participate in their relationships as well as activities. This includes different psychotherapy approaches like behavioral, cognitive, family, and more. Sometimes the terms interdisciplinary and multidisciplinary are used interchangeably when referring to medical and rehabilitation teams. However, there is a difference, so let's clarify that first. On a multidisciplinary team, all of the members work parallel to each other. They have specifically defined roles based on their professions, and there is a hierarchy of authority. The physician is responsible for leading the team and coordinating the care carried out, but each team member will develop their own goals for the client or patient related to their discipline. The physician communicates with all of the team members, but the rest of the team members would not necessarily communicate with each other. On an interdisciplinary team, the physician can still be responsible for leading the team, although it might not necessarily have to be the physician, but the team members work together with the patient to determine collective goals and treatment plans for the client or patient. There should be no hierarchy, as everyone should be seen as being on the same level. The team meets regularly to collaborate and communicate. As Corner notes, communication is continuous and multilateral. So why do we need interdisciplinary work? Hooker and Emery Tiburcio have pointed out that no single professional is likely to achieve optimal results alone. Though there is more research to be done on the interdisciplinary team approach, the available evidence suggests that it is associated with improved outcomes in patients with chronic pain, traumatic brain injury, pulmonary rehabilitation, lower back pain, and more, with the strongest evidence for stroke. Shorter length of stay, reduced hospital costs, and increased patient, family, and staff satisfaction have also been found. Singh and colleagues argue that the interdisciplinary model is often more effective because, quote, it allows a collaborative, holistic, and patient-centered approach to rehabilitation. The acceptance for slightly overlapping or blurred boundaries between professional roles facilitates more rapid information transfer, earlier interventions, and has been shown to expedite earlier discharge. While the success of the team is the responsibility of all of the team members, in most healthcare settings, doctors have usually been the ones to lead the teams. As such, they have the responsibility of coordinating the collaboration of the team. In addition, in many countries, the legal responsibility for the patient and the decisions made for the patient often lies with the doctor. The doctor must be aware of any decisions made, as well as be able to defend them. So there is a significant responsibility and role that the doctor plays within the interdisciplinary team in ensuring that the appropriate health professionals are on the team in order to meet the care needs of the patient, that there is effective coordination and communication of the team, and that the team is working with a unified purpose, ultimately to optimize the outcomes for the patient. What does a successful team look like? According to Newman and colleagues, key features of a successful interdisciplinary rehabilitation team include the following: agreed aims, agreement and understanding on how best to achieve these aims, avoiding jargon unique to particular professions during communication, appropriate range of knowledge and skills for the agreed task, mutual trust and respect, willingness to share knowledge and expertise and speak openly. Other authors have also suggested that regular team meetings, including those with family, patient-focused care with shared decision-making, a highly collaborative working environment, being comfortable with blurred professional boundaries between different disciplines are essential to a successful team. It is extremely important that the entire rehabilitation team gets involved with the patient's care right from the start and to be considered part of the primary care team. Historically, the primary care team has naturally always included doctors and nurses, but not necessarily the other team members. As noted earlier, doctors are often the leaders of rehabilitation teams, which puts them in the position of being able to ensure that the appropriate interdisciplinary rehabilitation team is put in place for their patients' care right from the start. This means that doctors should have a thorough understanding of who the members of the rehabilitation team are and the knowledge and skills that each provides in order to adequately address specific care goals. In addition, through collaboration with the rest of the team, the doctor is able to order the appropriate assessments and ongoing treatments for the patient. I hope this has been a helpful overview. Thank you for watching.